All right, good afternoon. Good afternoon, everybody. All right, good afternoon. Welcome to the University of Colorado Physical Therapy Program, class of 2024 clinical send-off ceremony. We are so grateful to be able to celebrate this milestone in your PT journey and are really glad that so many of your friends and family could join us to celebrate you on this special day. To the class of 2024, in just a little while, you'll revisit an oath. The words of this oath that you recited when you entered the program represent an opportunity for you to publicly display a transition. 2 years ago, it symbolized a point of passage into a new phase in your education and your learning, your entry into a doctoring profession. Today, the words of this oath represent a different transition, a transition into the final phases of your education, the beginning of a transition into professional practice. In addition to reciting an oath, you will receive and wear your white coat or pin. The white coat or pin you receive today is far more than a piece of clothing. It's a symbol rich with meaning and tradition, signifying your entry into the healthcare profession. This ceremony, rooted in the traditions of medical education, signifies a rite of passage, welcoming you into a professional community committed to the highest standards of patient care and professional conduct. In the field of physical therapy, the white coat represents a commitment to healing, the power of rehabilitation, and the profound impact of restoring function and mobility to those in need. As physical therapists, you will be an integral part of the healthcare team, working alongside doctors, nurses, and other healthcare professionals to provide comprehensive care to your future patients. As you look toward the completion of your physical therapy education, you acknowledge a commitment to lifelong learning, a commitment to the profession, and a commitment to your patients. This ritual reminds all of us of our responsibilities to our patients, particularly important at this time as you transition into the final clinical phase of your education. 2 years ago, the faculty of the University of Colorado also renewed an oath and a commitment to teach you, to challenge you, and to assess you at each and every stage of this journey, to ensure you were prepared to provide patients with the very best care, guided by the very latest evidence. We now congratulate you on completing the rigorous course of study and look forward to witnessing your growth in the clinic in this final phase of the program. Congratulations on reaching this milestone in your PT education. Next, I'd like to introduce Dr. Michael Harris-Love, Professor and Program Director of the CU Physical Therapy Program.
Okay. My job here is fairly easy as a warm-up speaker for Dr. Joe Palmer, as well as Abby and Hannah. So again, welcome to our parents, friends of the program, and of course, our students. So again, in addition to welcoming you to our celebration, I think I wanted to recall my first clinical rotations. I think many therapists who are here also remember that time. And we were filled with the same nervousness and probably excitement that you have here now. Everyone in my old school, they had to complete at least one rotation in the acute care unit of our hospital. And all of my classmates had heard the same rumor that I had heard, and that was to avoid the subacute unit at all costs. Because there was one clinical instructor there who was really known for being tough. And as luck would have it, that was exactly the rotation that I landed, a student rotation in the subacute unit with Sula Pampuri. Sula had been a physical therapist longer than I had been alive, and she had probably forgotten more about physical therapy practice than I would ever know. Sula was barely 4 feet 11 inches tall, and without fail, she wore a white nurse's coat and hat, as well as the orthopedic shoes to match, and she had the hair to match. And it's interesting to think about her now because she's not exactly the embodiment of terror, but you have to trust me on this one. Intimidation comes in many forms, right? She was directing her communication. She was known for quizzing students on the spot, anywhere, anytime, and she demanded a high standard of care from her trainees. Students responded to Sula, I think, in a variety of ways. Some rose to the challenge of her exacting standards, and there were others who crumbled under the pressure of their own making. I really didn't know what to think of her, but coming across a fairly complex patient during my rotation, I thought about keeping my questions to myself and maybe giving off, I don't know, like a false air of confidence. But I felt bad about needing to seek her assistance right at the outset, but I would have felt worse had I not given that patient the best care that I could have. And while I was happy to chase down all the answers to my clinical questions, I soon came to learn that Sula was really the best resource I had in the clinic. And by letting down my guard and engaging what I once feared, I allowed Sula to be the great teacher that she was. And I also allowed myself to get the most out of my learning experience. I think it's common to believe that your battle with imposter syndrome will start once you land that new job or that next position. And maybe that's true. But I also think that the battle against imposter syndrome, it doesn't start later. It really starts right now. Getting the most out of your clinical experience requires you to be curious. And to be curious, you must be vulnerable. You must be open to admitting that there's things that you don't know, and to incur the judgment of others and still have the personal courage to move forward anyway. So, one way to overcome imposter syndrome is to not to display a false sense of confidence. It's having the curiosity and the vulnerability required to grow as a clinician. And the only way to transition from novice to competence to excellence to clinical mastery is through this process. So don't allow your fear to short circuit your curiosity. Your path towards clinical mastery begins here and it begins now. Good luck, and I wish you well.
All right. Thank you, Dr. Harris-Love. Next, I'd like to introduce our student speakers from the class of 2024, Abigail Castro, Hannah Mader, and Jordan Altoff. We will hear first from Abigail, then welcome Hannah and Jordan to the podium.
Oh my gosh. Students, faculty, family, and friends, thank you all for joining us for our first white coat ceremony for the class of 2024. We are gathered here to celebrate a significant milestone, the end of our didactic learning, thank goodness. Our white coats signify trust, knowledge, and professionalism we will all embody when treating our patients in just a few weeks. The road to get here has not been easy. Within the past 2 years, all of us have managed our own unique set of challenges. Whether it's being the first in your family to attend college, working a part-time job to make ends meet, meticulously planning a wedding, or tending to the needs of our children, and driving for over an hour in this crazy Denver traffic. I'm sorry, I'm really nervous. Despite our unique journeys, there's a unifying element that binds us together, the resilience and commitment that have driven us toward our shared goal of becoming physical therapists. This past year, I've had the privilege of featuring many of the students in this class, and a question that always resonates is why physical therapy? Every answer centers on the powerful connection we build with our patients, empowering them to reclaim their lives and achieve their full potential. Albert Pike once said, "What we do for ourselves dies with us. What we do for others and the world remains and is immortal." As physical therapists, we have this unique opportunity to embody that statement. The knowledge we've gained, the skills we've mastered through countless repetitions will be used not just for our personal gain, but to improve the lives of countless individuals. The most important aspect of our profession comes through our work with our patients, the reason we embarked on this journey. Donning these white coats signifies the start of our careers. While knowledge is our foundation, we'll be there for our patients' struggles, triumphs, helping them get back to doing what they love. The profound impact we leave on others is the true heart of our calling. Thank you.
Hello. Sorry. Hello, class of 2024, students, faculty, and loved ones. Abby's already touched on this, but we'd like to emphasize again. What we've done up to this point has been really hard in a variety of ways, and for many different reasons. We should all be proud of surviving and occasionally thriving in the tumultuous journey to get to where we are right now. Now that we've made that clear, we'd like to touch on something a little bit less well known.
What many may not know is the hesitancy, extensive dialogues, and questions that surrounded the decision to receive a white coat today. A white coat comes with a multitude of different meanings that span a wide spectrum, from pride in our extensive medical accomplishments to the representation of historically oppressive power structures. These are the things that some physical therapists have spent the entirety of their profession fighting for and others against.
A white coat has inspired a lot of debate around where physical therapists fit, how we relate to other healthcare professionals, and how we see ourselves. This debate from within our profession and within our class has hammered home the idea that advocacy is an integral part of the core values and ethics of the physical therapy profession. This is a skill that our class embodies.
Throughout our 2 years in this program, we have learned to advocate for ourselves. We've asked for assignment extensions.
We've fought tooth and nail to get points back on questions that we didn't agree with.
When we were all thinking that our first week of MSK couldn't be drowning us faster, Andres even wrote, "Send help" across the lab home screens.
Now that's advocacy.
We've also learned to advocate for our patients
through an assortment of courses emphasizing a patient-centered mentality,
through our extensive clinical education,
and through our many role-playing scenarios that really only Justin loved.
Lastly, we have learned to advocate for the profession, whether through participation in mock debates,
through the formidable Tammy Struessel herself,
or through a silly little dance that Annie made us do in the quad to raise awareness for PT legislation.
But one thing that we know for sure is that when we successfully advocated for all of these things, we didn't need a white coat. White coats are known to some as a symbol of power, to some as a symbol of professionalism, and known to others as a symbol of knowledge. Whatever they symbolize, we know that we've learned to advocate in a variety of ways.
Where we head to next is learning to balance who, when, and what we advocate for, regardless of what we're wearing. Be that a white coat, perhaps just on Halloween from here on out,
business professional slacks,
scrubs,
the far too common polo and khakis,
purple shirts with matching ties, shout out to DJ,
bow ties if you're feeling more of a Joe Palmer vibe,
or high heels, a dress, and a long, obnoxious lanyard per Amy.
Whatever the symbolism and whatever the outfit.
We as a class have learned to balance power, knowledge, and professionalism.
And this ceremony is a celebration of just that. Thank you.
All right, thank you, Abigail, Hannah, and Jordan. Our last speaker this afternoon before student introductions is Dr. Joe Palmer, Assistant Professor and Director of Clinical Education in the CU Physical Therapy Program.
I would not have agreed to speak if I'd known I was going to be following that. That was awesome. And also, before I get into my scripted words, I just want the class to know that Michael and I did not talk about his speech in relation to our last CE3 prep class that we had a few hours ago, but that was awesome. Okay, so today's ceremony marks another waypoint in your journey as a professional. You will partake in a white coat ceremony followed by the recitation of an oath. In today's fast-paced and rapidly changing world, it can be easy to go through the motions during events such as this. Some even argue that an oath can be morally meaningless if we neglect to be fully present in a moment, reflect on where we have come from, and begin to dream of who we can be. The professional journey we keep alluding to is not about looking or acting like a physical therapist. It's about being one. William Sullivan defines a profession as an organized, service-based occupation founded upon formal knowledge and skill. The individuals within those who are learned, licensed, and supported by a collegial organization of peers, and who profess an ethic of service to clients and the public. A profession is, then, about belonging to something larger than yourself. Making the commitment to become part of the physical therapy profession means that you are not just willing to perform the required skills, but you are also willing to understand and advocate for the bigger picture of how we can change the lives of others. You have already taken an oath when you started this program, and today's white coat ceremony is another way to recognize this professional commitment. It could be easy to question, isn't this just a coat? To the contrary, in health professions, the white coat symbolizes professionalism, caring, humanism, and the trust that must be earned from your patients. Donning the coat offers an opportunity to reflect. There it is. Reflect on why you have chosen this path and what you hope to accomplish while wearing it. As you don this coat today, you can take an additional step on the journey of being a physical therapist as you continue your commitment towards embodying your own professional identity. It could also be easy to question, aren't the words in this oath just words? And again, to the contrary, words can carry power. Words can tell a story, and most importantly, words can lead us down a path of growth and healing when we also listen and reflect. I invite you to consider the power of words, particularly in our current time of polarized views and often fractured communication. The physical therapy profession is centered around vulnerable individuals, your future patients, and you will have the opportunity to use words in many ways, to create understanding, to build relationships, to facilitate recovery, and to advocate. Because of this, we must choose what we say carefully, and most importantly, we must choose to listen intently to our own words and those of others. In an article by physical therapist Dr. Denise Wise, an oath is defined as, quote, a vocal, solemn promise made in the presence of others, signifying the binding nature of the promise made, end quote. An oath is often described as part of a transformative moment in the life of a student or a new professional. When you started this program, we used carefully crafted words to signify the beginning of your journey to becoming doctors of physical therapy, and ultimately your acceptance of your duty to serve society through the physical therapy profession. Today, we will repeat these words to remind and reaffirm this commitment each of you have already made. Our profession requires moral agency and courage, autonomy, respectfulness, and professional humility. Today is another milestone in your professional journey as you're nearing the completion of your didactic coursework and prepare to put action to your education in your final clinical experience this fall. I invite you to reflect on your own professional growth over the last 2 years and pause from your busy day-to-day lives to recognize the coat you receive and the words you will soon recite are a reminder to embody those notions each and every day of your professional lives. Continue on this journey towards becoming a DPT professional by deeply considering the words you say today. In fact, these words may hold more meaning for you now than they did when you started this program over 2 years ago. You have already begun to bring these words to life in your time as a student, and if you choose to live by them as you enter this next phase of your education, you can better the profession, change lives, and change systems. So choose your words carefully and listen intently. We, your faculty, have been honored to be a part of this transformative journey with you up to this point and look forward to great things each of you will accomplish this fall and throughout your careers.
In a few moments, we will recognize each of the students in the class of 2024. As their names and information are shared, we ask that you hold your applause till the end. Students, as your name is read, you will make your way across the stage to receive your coat from Dr. Harris Love. We will wait to don our coats until after we recite the oath, and we'll put them on together. These students have worked hard to get here, and the journey has been challenging, as they've said. Since their arrival on campus, the class of 2024 has completed nearly 2.5 years, 8 semesters, and 116 graduate credit hours of work to become dedicated physical therapists. This has required perseverance and focused learning. There have been days filled with classes and evenings and weekends filled with studying, reading, practicing, and refining your skills. These were times of growth, from the novices you were when you arrived, learning to put on gait belts, to the experienced student physical therapists you are now, ready to embark on this final clinical phase of your journey. Together, the class of 2024 became colleagues, and we, the faculty, worked to ensure they became excellent physical therapists. In the end of your time at CU, you and your family and friends will be incredibly proud of the healthcare provider you will have become. In this next part of the ceremony, we will recognize each member of the class of 2024 as they come forward and receive their coat or pin. They were asked by their peers who led the planning of the ceremony to share one thing they learned, remembered, or found impactful during their time here, which will be shared with all of you. In addition, you'll hear where they are going for their final clinical experience starting at the end of the month. Following the processional, the class of 2024 will renew the oath together in front of our community, then collectively don their white coats and pins to mark their transition into the final phase of their education. Then we will celebrate this point of professional passage together at an outdoor celebration taking place immediately following the ceremony. Now let's recognize the University of Colorado Physical Therapy Program class of 2024. Jordan Altoff. Yep. Jordan is headed to UC Health Physical Therapy and Rehabilitation Clinic in Central Park. And she remarks that the thing she found most impactful was the friends and relationships she's developed through PT school. Goni Altman. Goni will be headed to UC Health Memorial Hospital for her CE3 clinical experience. And she's reflecting on the fact that for the rest of her career, she will have to break the ice by introducing herself as Goni, like shorthand for the goniometer, so people don't feel uncomfortable bringing it up. She also remarked how important it is to be open-minded as a clinician and willing to learn from others. Ashley Atencio is headed to UC Health Anschutz Inpatient Pavilion for her CE3 clinical experience. Ashley says the 2 main lessons she has learned through physical therapy school is 1, it always depends, and 2, that she knows this accomplishment wouldn't have been possible without the support of her family and lifelong friendships she's made here. Jerica Beza is headed to Advent Health in Castle Rock for CE3. She has learned that when life sends obstacles your way, turn them into an intervention. If you succeed 80% of the time, don't change a thing. Hannah Barrett is headed to Children's Hospital Colorado in Aurora. She's remembering that mnemonics save lives. How else would she have remembered the facial nerves if it wasn't for those twerking zebras that bit Miley Cyrus? Kyle Bergevin is headed to Children's Hospital Colorado at the Anschutz Medical Campus. Kyle's reflecting on the importance of being the one who listens and being the one who cares. Carly Burkhoff. For CE3, Carly will head to Copper Queen Community Hospital. She says she is always grateful for her fantastic cohort of friends. May their passion for hacky sack never die. Brooke Beyruti. For CE3, Brooke is headed to medical services at CU Boulder. She said the one key lesson she's learned from the DPT program is that achieving a healthy work-life balance and engaging with peers for support are crucial for delivering effective care and ensuring long-term personal and professional growth. Liz Bindert. Liz is headed to UC Health Physical Therapy and Rehabilitation at the Anschutz Medical Campus for CE3. During her time in the DPT program, she's found her cohort's attitude, fun-loving spirit, and the excitement to learn to be the most impactful factor, motivating and inspiring her to pursue this career with an open heart, learning, growth, and the pursuit of excellence. Colleen Boast. Colleen is headed to Rio Grande Hospital Physical Therapy for CE3. She said this program has taught her many things, not only academic, but has helped her grow as a person and foster lifelong friendships. But the most important thing she's been able to learn and to graduate from, mitochondria is the powerhouse of the cell, to C345 keeps the diaphragm alive. And also, hi, Mom. Grace Brackmeyer. Grace is headed to Solace Pediatric Home Healthcare in Denver for CE3. She is grateful for both the personal and professional growth she's experienced during the program, most notably her improvement in her hacky sack skills. Mackenzie Cadwell. Mackenzie is headed to the Rocky Mountain Regional VA Medical Center for CE3. She says the one impactful lesson she's learned from a clinical instructor is that we don't fix people. We facilitate their growth and guide them on their own healing journey. Be a facilitator, not a fixer. Elena Callanan. Elena is headed to Coal Creek Physical Therapy in Louisville for CE3. And she's reflecting on the fact that a DPT program is a lot like running an ultramarathon, a stressful roller coaster of emotions that goes a lot better with the support of friends and family. She certainly couldn't have done it without either of this group of inspiring enablers. Abigail Castro. Abigail is headed to Children's Hospital Colorado in Colorado Springs. She says she's learned that PT school and clinical rotations are a lot like a box of chocolates. You're never sure what you're going to get. Brandon Chase. Brandon is headed to Grand Valley Rehabilitation Services for CE3. His most impactful experience that he had in the DPT program was when he realized that the Bryce power stance will make his career an additional 10 years due to good body mechanics. Inez Credo. Inez is headed to Physical Therapy of Boulder for CE3. She said the most important thing she's learned in PT school is that it depends. Maisie Deal. Maisie is headed to Cascade Sports Injury Prevention and Physical Therapy for CE3. She's reflected on a quote by the great Catherine Bilyeu, who said, "Growth happens just outside of your comfort zone. This program has given me courage, taught her to embrace discomfort, and reminded her that she doesn't have to be perfect to be enough." Angela De Los Santos is headed to UC Health Physical Therapy and Rehabilitation Clinic at Inverness for CE3. She said that she's learned that a doctoral program is no joke. She's learned so much about the body, patient care, and what it means to be a physical therapist these past 2 years. More significantly so, she's learned her own resiliency going through stressful times and prioritizing time for fun things that make her happy. Arielle Dos Santos is going to UC Health Physical Therapy and Rehabilitation Clinic in Prospect. Arielle says, embrace life's gentle sway. As Robin says, sway is good. Adapt and reinvent yourself to stay balanced through career challenges and rely on the support of your village, friends, and family who will guide and uplift you along the way. She says thank you to all her friends, family, and partner for not letting her go bananas. Maura Downey is headed to Integral Physical Therapy in Firestone. She says thank you to her friends, family, and Nick for supporting her throughout her time in the program. Ethan Dvorak is headed to Craig Hospital for CE3. He says one valuable lesson he's learned during his time in the program is the importance of being patient-centered and prioritizing the patient's wants and needs when developing a plan of care. Sabra Epp. Sabra is headed to Howard Head Sports Medicine in Eagle. She said she feels like the importance of being able to reflect on all of her experiences and even to reflect on my own reflections. Chantel Foltz. Chantel is headed to ATI Physical Therapy for her last clinical experience. She said one important lesson she learned was the importance of resilience in the face of adversity. Navigating academic and personal challenges taught her that perseverance, adaptability, and a positive mindset are essential for tackling adversity and achieving long-term goals. Sophie Giroux is headed to Select Physical Therapy in Castle Rock. She says she is grateful for the supportive and positive community this DPT program has built. This program not only fostered professional growth, but also respected and encouraged her individuality outside of school. Hope Heron. Hope is headed to Children's Hospital Colorado in Highlands Ranch for CE3. She said a key lesson she will carry throughout her career is the distinction between helping, fixing, and serving. While helping and fixing focus on weakness and problems, serving honors each individual's wholeness. She's excited and grateful to serve a population she's passionate about in CE3 and to continue her commitment to lifelong learning. Sydney Haynes will be headed to St. Vrain Valley School District for CE3. Sydney says she's discovered her love for school-based physical therapy during her first integrated clinical experience while at school at CU, and she's excited to complete her final rotation in her local school district. Carmen Hauk. Carmen is headed to Health One Skyridge Medical Center for CE3, and she said her greatest memory will be meeting wonderful people and making amazing friends. Julianne Iruso is headed to Panorama Physical Therapy in Golden for CE3. She says your success is not defined by being perfect. It is defined by your humility, your curiosity, and your willingness to learn. Renee Jones. Renee will go to Blue Sky Physical Therapy for CE3. She says she is grateful for the people she's met through the program and the memories she's made. Gabi Jordan will be headed to CU Boulder Medical Services for CE3. She says, be confident, stay humble, and never stop learning. Caitlin Kalmar is headed to Health One at Rose Medical Center for CE3. She says as she pursues her final clinical and eventual career in acute care, she will be constantly thinking, what would Dan Malone do? While the last 2.5 years have been jam-packed with material, she's excited to continue learning throughout her career to be the best PT she can for each of her patients. Katie Kennedy. Katie will be headed to UC Health in Greeley for CE3. She wrote that she is really proud of having made it to this point. Grace Colleen. Grace will be headed to UC Health in Broomfield for CE3. She said she was impacted by meeting such unique, talented people in this program. Every day she learns something new about someone's passions or experiences, and it's truly been an honor to learn from her classmates. Jessie Klaus. Jessie will be headed to Advanced Physical Therapy for CE3. Jessie remarked that she found her first clinical rotation very impactful, and her CI there was a great teacher and greatly improved her confidence. She looks forward to her first clinical rotation in outpatient ortho and getting experience in sports, pelvic, and aquatic PT. Tony LaRue is headed to UC Health in the Yampa Valley Medical Center. Tony says the variety of clinical experience he's had while here at CU has pointed him in a direction he hadn't considered before. Remy Lathrop. Remy is headed to Encompass Health Rehabilitation Hospital in Littleton. She said during her time in the program, she fondly remembers getting to practice clinical skills, learning from peers, and giving back to the Aurora community through her work at the Dawn Clinic. Anna Loria. Anna will be headed to Physical Therapy and Balance Centers in Applewood. She said this program has encouraged collaborations in all aspects of learning and physical therapy practice, and she'll take this with me into her career. She's also proud of having learned to hacky sack. Alexis Levers. Alexis is headed to Select Physical Therapy in Cherry Creek for CE3. She's remembering the words of the lovely Amy McDivitt, who says, stay optimistically curious. Nikki LeVar is headed to the VA at the Floyd K. Lindstrom Clinic. Nikki's remembering a wise quote from Robin Gisbert that says, I give my permission to be imperfect today. I give myself permission to be imperfect today. Justin Lewis. Justin is headed to outpatient physical therapy in Seattle for CE3. He said he's learned the meaning of the phrase, it depends. It means there is no stock, uniform answer to even seemingly simple patient problems or questions, and that the joy of PT comes from staying curious about the differences in multiple right solutions to find what fits each of our patients most appropriately. I think that's the best definition of it depends I've ever heard. Austin Lee. Austin is headed to Howard Head Sports Medicine in Edwards for CE3. He said it's because of the people in this room and the friends and family who couldn't make it that he's able to be here today and to become a future doctor of physical therapy. Jessica Linnemeyer will be headed to Advent Health in Parker, sorry. And Jessica says a patient's life can be changed when you not only understand the treatment they need, but also the person you're treating. Hannah Mader. Hannah's headed to Concentra Medical Center for CE3. She said she will always remember how their class built such a supportive and fun community that got them through so many hard times. Annie Majewski. Annie is headed to Physical Therapy of Boulder in Longmont. She asks, what do cranial nerves, playing volleyball, and summiting mountains all have in common? They were all fueled by the friendship she's made along the way, and beef sticks. Jared Maxon. Jared is headed to Integral Physical Therapy in Thornton for CE3. He said, an impression that rang true throughout my time here in the program was, we are lifelong learners who aren't just students, but colleagues beginning the day you begin school. Jamie McMullen. That's you. Jamie is headed to UC Health Anschutz Inpatient Pavilion for CE3. He says, quality personal therapy care starts with person-centeredness. We can meet our patients anywhere they are and help them in their journey to recovery. Michael Nam. Michael is headed to Innovage for CE3. And he says, if you love something enough, you can convince 74 of your classmates to play volleyball during lunch. Ella O'Rourke. Ella is headed, nope. Oh. Ooh. I think we always do this. Yes, yeah, I got you, Bea. Beatrice Isabel Garzon Oliva. Got it. Is heading to UC Health at Parkview Medical Center for CE3. She said one thing she has learned throughout the program is that you don't have to give up your passions to pursue a doctorate degree. You can still continue your sport, compete, or join new recreation if it empowers you and your future patients. Ella. Yeah? Yep. What do you have next? I need Ella O'Rourke. Okay, Ella. Ella is going to Denver Health Medical Center for CE3, and she says during her time in this program, she's learned that educating on the purpose behind each intervention is key to delivering effective patient care. It's so much more complex than the hip bones connected to the thigh bone is connected to the knee bone. Miss Ayala Aronia. There we are. Is headed to UC Health Physical Therapy and Rehabilitation Clinic at Inverness. He said he's learned to evaluate and treat patients, sometimes at the expense of his own self-care. He says he could use a thorough assessment and targeted intervention for the numerous impairments he's dealing with right now. Andres Ortiz Torres is headed to Concentra Medical Center in Albuquerque for CE3. He said he's learned that even with all of the seriousness of school and life, there's always a little bit of room for fun and joke. Amber Pearson. Amber is headed to Physical Therapy and Balance Center in Arvada for CE3. She said the most impactful part of this program was the family she found in her peers and professors as a Colorado transplant. She didn't choose them, but always had their support and love, and loves them all for accepting her as she is. Sorry. Victoria Pennington is headed to Integral Physical Therapy in Erie for CE3. She said during her time at CU Anschutz, she has learned the art of being a lifelong learner, cultivating curiosity, resilience, and personal growth while broadening her perspectives and fostering meaningful connections. Ellie Penny. Ellie is headed to UC Health in Poudre Valley for CE3. She said the most important part of her time in the program has been the people she's met along the way, and because they are what has brought her to where she is today. Kate Petty. Kate will be headed to Rocky Mountain Physical Therapy in Thornton for her CE3 experience. She said she's learned to embrace both her strengths and her weaknesses in order to grow as a student physical therapist. Sophia Phillips. Sophia is headed to N2 Physical Therapy for CE3. She says she is grateful to have been surrounded by supportive faculty and peers that encouraged her to pursue her passion of pelvic health PT and to maintain a work-life balance throughout PT school. Jordan Raidbaugh. Jordan will be headed to Next Level Sports Performance for CE3. He says one significantly impactful thing he's learned during his time here is the interplay of pain in the central nervous system and how important it is for medical professionals to validate our patients' pain experiences. Kaylee Reed. And Kaylee is headed to Children's Hospital Colorado in Highlands Ranch for CE3. She's found what she's found important through her time in the program has been that everyone has something unique to teach us about life and the world around us. So listen. Andrew Romero. Andrew is headed to UC Health Children's Therapy Services for CE3. He says the people might not remember what you said, but they will remember how you made them feel. Ian Sanborn. Ian is headed to Children's Hospital Colorado and the North Broomfield campus for CE3. He said the most impactful thing from PT school are the friends he's made along the way. Anna Schroeder is headed to Health One Rocky Mountain Hospital for Children for CE3. She says she would like to express her gratitude to family, friends, and faculty for their support during the program. Their encouragement during the program has inspired her to expand her skills, approach challenges from diverse perspectives. She is eager to apply these qualities throughout her career and continue growing both personally and professionally. Eric Sells. Eric is headed to Panther Physical Therapy for CE3. And he's remembering a quote from Toby, who says, "It is important to know things." Brian Seidschlag is headed to Proactive Physical Therapy in South Glen for CE3. He says, listening to your patients and allowing them to tell their story may be our most valuable tool in a profession full of complexity, choice, and gray areas. Luis Sosa Salinas is headed to Colorado State University for his CE3 experience. He said throughout this program, he's learned to harness his personal strengths to develop his clinical identity. Sam Strasburger. Sam is headed to Middle Park Health in Granby for CE3. He says he will remember the many great friends that he's made along the way. Kyle Seuss is headed to Trailhead Physical Therapy in Highlands Ranch. Yes. He said his fondest memory is making 75 of the best friends ever. And go Birds. Hannah Swearingen is headed to Boulder Community Hospital for CE3. Hannah says life presents challenges and remember to embrace resilience. Michael Tran is headed to the University of Colorado Sports Medicine and Performance Center for CE3. Dylan Wagner. Dylan is headed to Next Era Physical Therapy in Centennial for CE3. And I think speaking from experience, he says, don't break your wrist or hands. They're kind of the money makers as a physical therapist. Audrey Warner. Audrey is headed to Health One Spalding Rehabilitation Hospital for CE3. She says she has felt grateful to be surrounded by students who are passionate about learning and who are willing to help each other grow as future clinicians. Cassidy Weeks is headed to Life Care Center of Aurora for CE3. She says she has learned the importance of being fully present with patients and treating the whole person. This holistic approach and connecting with patients is something she will carry with her throughout her career. Lauren Wolf. Lauren is headed to Outpatient Neurotherapy Center of Denver. She is also fond of the mnemonics she picked up along the way. As she says, on, they traveled and found Voldemort guarding very ancient Horcruxes. Ashley Workman. Ashley is headed to Denver Regional Rehabilitation Hospital for CE3. She said one thing she's learned throughout the program was the importance of self-compassion. Juggling the demands of coursework with personal interests taught her to be gentler with herself, acknowledge her limits, and celebrate even the small victories. Ladies and gentlemen, the class of 2024. All right. And now will the class of 2024 please rise? Together again, we will recite our professional oath, marking your transition to the final clinical phase of your education and reaffirming your commitment to the physical therapy profession. In the presence of family, fellow classmates, and faculty, and in the view of the honored profession of physical therapy, you again solemnly and willingly pledge the following as an oath of commitment. I commit myself to the highest ideal of service. I will strive to achieve excellence. I will learn. I will hold all confidences in my heart. I will strive all I will strive to approach each I will respect the rights, knowledge, and skills of other colleagues and seek consultation. I will strive to be a lifelong learner, seeking to advance my own knowledge. I will approach mentors and colleagues to guide me through this free accept all the obligations. Having spoken these words, I am prepared tomorrow. Bring me one step closer to achieve becoming a doctor. All right, yes. All right. The white coat, as you've heard today, has many meanings. One of those is that it is a symbol of trust. It's a reminder that patients will look to you not only for your expertise and technical skills, but also for your compassion, empathy, and dedication. It represents the responsibility you now bear to uphold the principles of ethical practice, to maintain the dignity and confidentiality of your patients, and to pursue excellence in all your endeavors. Class of 2024, you may now put on your white coats or pins, officially marking your transition into this final phase of your education.